Hi, Andrew Wolf here. In this video I'm going to talk about the hemolytic disease of the newborn. Now, before a woman has a baby, we're going to be talking here about a woman who is Rh negative. So that means her red blood cells do not have the Rh antigen. And she also has, no Rh antigen and no Rh antibody. But say she gets pregnant from a man who has Rh positive blood. So the man is Rh positive. So he also has no antibodies against Rh, but he has an Rh antigen. So his little red blood cells express the Rh protein. Okay, no big deal yet. It's not going to hurt the mother, it's not going to hurt the father. Now there is a 50% chance that this baby is going to have the father's genetic trait for Rh positive blood. Okay, so let's say this is one of the unlucky ones. And this baby, actually the baby's not unlucky, but the baby's brother or sister later on maybe. So this baby is one of the 50% that inherits the Rh trait from the father. Now this means that this baby's red blood cells express Rh positive or Rh antigens. The mother, again, has red blood cells with no Rh antigens, and her bloodstream also has no Rh antibodies in it. Now, this is not a big deal that the baby has Rh positive antigens yet, because there is a barrier between the baby and the mother in the placenta. So it's the blood-placenta barrier. And this prevents passage of the baby's red blood cells. And it also prevents passage of proteins to and from. Okay, only small particles can get in there into the baby. However, during Andrew Wolf here. In this video I'm going to talk about the hemolytic disease of the newborn. And here we have a mother's bloodstream, and this mother is Rh negative. So that means that her red blood cells do not have any Rh protein antigens on their membrane. Now this mother gets together with the father, who is Rh positive. So he has Rh antigens on his erythrocyte membranes. So that's little proteins on these membranes. So they're Rh. Now this baby has a 50% chance, the baby between this mother and this father has a 50% chance of having red blood cells with the Rh antigen expressed on its membrane. Okay? So during pregnancy, this mother's blood and the baby's blood don't mix, because there is a placenta that provides a barrier to cells and proteins. Similar to the blood-brain barrier, there's the blood placenta. barrier, and this prevents their from being mixing of the baby's Rh positive blood and the mother's Rh negative blood. So for this baby and this mother, there's no problem at this time. However, during birth, during the process of birth, this placenta blood barrier is broken down. And as the baby is born, some of this baby's blood is going to get in to the mother's bloodstream. So now the mother's bloodstream is all of a sudden exposed to Rh positive blood. Now, what happens? It doesn't cause a major problem. It's not very much blood. It's a very tiny little bit that slips across the placenta, so it doesn't cause the mother any problems. However, over the coming weeks, I should say, the mother begins to create an antigenic response to this by creating antibodies. And again, these antibodies, there aren't enough red blood cells to cause significant problems. But what happens is the mother develops memory B cells that have the potential to create massive amounts of these antibodies. Okay, now, a year or two later, this mother and father get together and have baby number 2. Now this baby also has a 50% chance, and we'll say this baby is the unlucky one. So this baby does have Rh positive blood, just like her father. So she's got red blood cells that express the Rh antigen, or the Rh protein. And during pregnancy, again, there's no problem because there's no mixing across the blood-placenta barrier. But this mother's blood now has plasma cells that are generating antibodies against Rh. But again, during pregnancy it's not a problem because this placenta is intact. What happens is during birth the blood-placenta barrier is broken down again, and it's broken down for long enough for a significant number of these antibodies to enter the baby's bloodstream. So baby's born now, and within hours after birth, providers are going to start noticing that there's significant hemolysis because we have the baby's Rh positive blood that is being hemolyzed by the mother's immunoglobulins, anti-Rh immunoglobulins. So we end up with hemolysis. And baby number 2. Now, this all could be prevented. This used to happen in the United States up until the invention of a medication called Rhogam. This happened in about 16% of all live births. But now we have a medication called Rhogam, and Rhogam is a medication that is anti-Rh. So what we do is we give this to the woman right after birth, and the Rhogam actually attacks the baby's the Rh proteins on the baby's red blood cells. And remember, there's a small number of these in the maternal circulation, so the red blood cells lyse and are destroyed, and the Rh positive cells are excreted before the mother can begin to develop her own B cells and memory B cells. So there's no maternal B cells. So that way, when baby number 2 is born, mother doesn't have the ability to make Rh negative cells. So when the baby's born, she just has no anti-Rh immune globulins in her bloodstream to cross, so baby 2 is protected. So Rhogam prevents the mother from creating the anti-Rh immunoglobulins, so in future pregnancies her immunoglobulins will not attack the baby. Okay, so that's essentially what occurs. Now, if a mother does not receive Rhogam and her baby goes on to develop the hemolytic disease of the newborn, manifestations are going to be anemia, and the reasons for this are obvious because red blood cells are lysed and broken down. You're going to end up with hyperbilirubinemia, because remember, bilirubin is a breakdown product of red blood cells, and patients will also have icterus and kernicterus. And icterus is just a term for visible jaundice, and kernicterus is a term for the long-term sequelae of hyperbilirubinemia, which I think most significantly are neurological deficits. Okay, so that's all I have for this video on the hemolytic disease of the newborn. For quick and easy access to my other videos, please click here on this link for my hematology pathophysiology channel, and I'll see you in other videos. Thank you.